We're on location at MetroHealth Studio, and we have a question for you. Do you think you need a knee replacement? You may have second thoughts after we share a second opinion. Dan Zalewski is here with options for your knee arthritis other than an operation. Dan is a physician assistant in orthopedics at MetroHealth. So welcome to the show.
Thank you.
Lately, it seems like getting a knee replacement is just sort of a rite of passage. You get to a certain age and there you go.
Well, it doesn't have to be, and we try to not let it be a rite of passage. We look at a knee replacement as the last resort when it comes to treatment for knee arthritis. Arthritis is a loss of cartilage. So here's a model of the knee, and you see the blue stuff here is all cartilage. That creates a nice smooth articular surface for the joint to glide upon.
Okay.
But as we age, and we think it has a lot to do with genetics, the main cause, this cartilage can wear. And when it wears out, that's the definition of arthritis. Oh, okay. Now, the way we approach treatment of arthritis is to relieve pressure from the knee itself. So if you can focus on strengthening, muscle strengthening, if you can focus on keeping weight off the body, for every 1 pound of body weight you have, you're putting about 7.5 pounds of pressure on the knees. And that's just walking around. That's not doing anything more extraneous. If you can keep pressure off of that, then you can control the pain. And if you can control your pain with arthritis, then you don't need a knee replacement.
You don't want that surgery
just yet. You do not.
So why wouldn't you want the surgery? I mean, how hard is the surgery?
The surgery is something not to be taken lightly. It takes a certain mindset to get into something like a knee replacement. Of all the joint replacements, the knee is probably the most painful to recover from. It takes a good 6 months of recovery time and really hard work to get the real full benefit of the knee replacement itself. If you're not willing to put in that work, or you think that when you wake up and the surgery's done, you're cured, you're not going to be happy with the knee replacement. You're going to go back to stiffness and pain. Okay,
so when the cartilage kind of wears down, it doesn't grow back, so, right?
No, there's certain types of things that we can do to try to promote cartilage growth, but when it comes to arthritis, that's not really an option. That's more reserved for a young person with a sports injury that has a big chip of cartilage taken out. We can try to grow some of that back. But when it comes to degeneration from arthritis, there's no getting it back. Once it's gone, it's gone. What we try to do is relieve the pain and the pressure.
Okay, so one is lose weight. You mentioned that already. How about exercise? Are there specific exercises for this?
Absolutely. We try to make sure that patients go to physical therapy, or at the very least are doing exercises on their own to strengthen the quadriceps muscles, the thigh muscles, because they take a lot of pressure. If they're strong enough, they can take a lot of the pressure off of the knee.
Okay, so what specific types of exercises?
We do straight leg lifts, where you have your knee in full extension, your leg in full extension, and you're lifting, and repeating like that. Putting ankle weights on if that gets easy. And then same exercise, we tilt out to the side like this. If this is your foot, and you're tilting out to the side like that. And those are two exercises you can do that isolate specific quadriceps muscles.
Okay, so if you've tried all of that and you're still in pain, then it really comes to surgery?
Possibly. There are cortisone injections that we can attempt. There are gel shots that you can do. Of course, anti-inflammatory medications like Motrin, Advil, Aleve, or prescription strength versions of those are very helpful. But if all else fails and you've tried everything and your life is revolving around your pain and you have none of this stuff left, then we advise the patients consider it. However, you have to consider it at a certain age. You really want to stave off getting a knee replacement before your 60s. These have a shelf life of about 10 to 20 years.
Okay.
And
you don't want to have to go through it again.
No, you really don't. It's not the same procedure the second time around. It's much more difficult.
Okay, wow. Coping with knee arthritis may not be easy, but there are options you need to implement before surgery is the only solution, since those changes could actually help. And as MetroHealth says, change is healthy. My thanks to Dan for this need-to-know information.
My pleasure. Thanks for having me.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org.